When we talk cholesterol, for this episode, we're going to be talking total cholesterol. Okay, we know we can break it down to HDL, LDL. What we're going to talk about here is total cholesterol. Now, our desirable range for this is going to be less than 200 milligrams per deciliter. That's what we want, okay? That's optimal. Borderline will be 200 to 240, and high cholesterol is going to be anything that's greater than 240 milligrams per deciliter, okay? But the number you really want to know and you really want to teach your patients is we really want to have them under 200 milligrams per deciliter. So let's talk quickly about what cholesterol is. We all have a basic understanding of cholesterol, but let's talk about why we need cholesterol, okay? Cholesterol is a lipid, right? And what it does, it actually plays a key role in the formation of cell membranes, right? We have that phospholipid bilayer, and so we really need cholesterol to build those cell membranes. It also is a portion of what helps render our skin waterproof. So it's very important to our body. We really need some cholesterol. And then it plays a role in the formation of multiple other things in the body, like bile salts, estrogen, and androgens and things. So it plays a really important role. A lot of our cholesterol will come from our diet. However, there are a lot of places in the body that can actually form cholesterol, with the main production being in the liver. So it's a very essential component to life. But what happens here is because of diet and things like that, we can actually have highly elevated cholesterol. Some of the things we really want to keep in mind here, the reason we're going to run this test, okay, is that we want to assess for cardiovascular disease. There are tests that are done that show that optimal range to avoid cardiovascular disease would be under 200. There is a family component to that, and we'll talk about that here in a little bit. But some of the reasons that we're going to run the test are going to be to assess for risk for cardiovascular disease. We're also going to run our cholesterol to determine how effective medications for cholesterol are for the patient, if it's working, and just to really assess if there's any sort of family history with the patient. So some of the things that are going to increase our cholesterol, like we talked about before, if there's a family history of hypercholesterolemia, this patient or the patient might have a higher risk of high cholesterol. Other things that are going to increase cholesterol are alcoholism, anorexia, renal failure, diabetes, if it's poor controlled, and diets high in cholesterol and fats, and then obesity as well. Some of the things that can decrease cholesterol. Now remember, I almost don't want to say this, but low cholesterol, extremely severely low cholesterol, can be just as detrimental to health as extremely high cholesterol. When we talk low cholesterol, we're not saying this is what you need to do to have good cholesterol. When we talk this decreased cholesterol, these are patients who can get into states of too low cholesterol. So some things that can cause that are going to be hyperthyroidism, COPD, burns, liver disease, pernicious anemia, and those types of things can really cause decreases in cholesterol, okay? So some of the things you really want to teach your patient is to take cholesterol, we need to have a fasting diet, okay? They should really have a 12 to 24 hour fast prior to taking a cholesterol level. And important as well to mention to your patients is that because alcohol can elevate cholesterol, they really need to stay away from alcohol prior to having their cholesterol done. All right. And then patients who start on cholesterol medications, statins and things like that, they really need to have their cholesterol checked often. For patients that are borderline, they need to have their cholesterol checked every several months to every year, at least to see what the trend is, okay? So our desirable range is less than 200. We consider it high once it gets over 240.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE, and check out the free resources and other goodies that we have there just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.